Hello and welcome to Medicare Made Easy, a production of Blue Cross and Blue Shield of Louisiana, designed specifically to help my friends who are about to age into Medicare or who are already in Medicare and looking to make new choices. We're coming to you today from the middle of the Open Enrollment Program, the AEP, which will run until December the 7th. I'm Mike Bertaut. I'm a healthcare economist with Blue Cross and Blue Shield of Louisiana, and I'm really honored to be with Tress Fereday today, who is an expert on Medicare and Medicare Advantage. And I just want to tell you, Tress, it's a delight to be with you here today. And I'm hoping that you can kind of guide us through what's going on right now.
Right. So we're in the middle of, you may have heard the symbol AEP, Annual Enrollment Period, Open Enrollment. Those are some words you may have heard of. So you could be getting things in the mail. There could be commercials on television that are talking about Medicare, and you need to make your choices. And so you're not certain what to do, what are next steps. And so we're here to kind of talk you through it. There's some kind of questions you can answer, and it'll help at least guide you on what you need to do. So one of the first steps could be you deciding how long are you going to work. Are you going to retire at 65? Or are you going to work till 67? And is your employer offering, and the key phrase is credible coverage for you if you would continue to work. So you may want to kind of explore those options to understand, can you keep working and you're under their coverage or not? Or are you looking for an individual Medicare plan? So that at least can help direct you, because these dates of when you retire, you would need at 65 to enroll in Medicare Part A. Now, most people for Part A get it premium free because they've worked 40 quarters, they've been contributing to their Social Security taxes. So that could be an option for you. If you're going to enroll in Medicare, then you want to think about your Part B. Now, Part B can have a premium. It may have a premium for you, so it'd be nice to know what that is and help plan for that. Some folks may get extra help on that premium. So really, during this time, kind of understanding what options you're going. If you see a TV commercial and call a number and you don't have kind of your direction determined, you don't want to accidentally get enrolled in a plan that's not right for you, not a fit, or, contradicts what you have through your employer. So that's the only thing. Just kind of be careful of the information you're given, because you need to decide what's the best fit for you first.
Tress, I know we're in the annual enrollment period right now. Can you give us an idea how that's different from any other day of the year?
Well, for Medicare, during this annual enrollment period, if you're Medicare eligible, you can make a choice, a Medicare choice. Now, if you're already on a plan, maybe you have a Medicare Advantage plan, it's working for you, you're getting the care that you need, you may not want to make a change. And most plans, if you don't have to re-enroll, you would just kind of roll over to the next year. If you have an agent, it's really great to have an agent, one, to answer your questions prior to enrolling, or once you even have a plan, because they can help answer your questions. If you're healthcare, if you're going to have some changes in your healthcare, maybe there's some new covered drugs you need, etc., they can help walk you through it. We call it a benefit checkup. So when you have a licensed agent who works with you on your Medicare, you can touch base with them and go, hey, this is working for me, or, there's this doctor I want to see. I want to make sure if they're in the network. My drugs are changing. My doctor has recommended I'm on these different drugs for these certain conditions. So it is appropriate, like once a year, to have a benefit checkup and make sure the plan you are is appropriate. You want to stick with it, or do you need to look for some other options because your health needs have changed?
Gotcha. So most of the year, if I'm enrolled in a plan, then I'll keep it right up until the open enrollment period, October 15th to December 7th, right?
Yes.
And then I can go in and change to another plan, which will probably start on January.
Right. Your new plan would start the first of the year. If the plan's working, stick with it. If it's not, you want to consult with a licensed agent to make sure it's the right fit. It's great to talk to families and friends. Maybe they're on a plan that's working for them, but remember, you have unique health needs, and so you need to make sure that the health care you need would be available to you. So, for example, do you want to get your care close to home? Do you see doctors kind of in your neighborhood, in your area? So you could opt for a plan with a narrow network and you can enjoy some cost savings. Or you travel and you really need nationwide coverage. So when you're traveling, you want to make sure you're able to see doctors, because what you don't want to do is unknowingly go out of network and incur extra costs, because there can be extra costs if you go beyond your network. So kind of understanding where my doctors are and who I can see and being clear on that is really helpful to make sure it's the right plan for you.
Gotcha. So I think it's fair to say during the open enrollment period, most of the ads and TV commercials and things we're seeing are directed at Medicare Part C or Medicare Advantage. Can you tell us a little bit about Part C and why that might be a better choice for most people?
So we talked a little bit, we'll talk about the parts of Medicare. There's Part A, which is your hospital coverage. There's Part B, that's your kind of medical and your doctors. Part C is what Mike's referring to as Medicare Advantage. So Medicare Advantage is offered by private insurance companies on behalf of the federal government. And what it does is it can wrap up these different parts of Medicare and offer you these services. In addition, there's a Part D, and Part D is prescription drug coverage. So many of the Part Cs, you'd have to find out which plan you're looking at. It could offer the A, the B, and the D combined. You could get dental coverage, you could get vision. They may offer a flex card that you could use for over-the-counter healthcare expenses, things like that. So the plan, it also may have some extras, but we don't want to just get caught on extras. Extras are good, but understanding what doctors you can see, understanding that your drugs are covered, and the extras is the combo you really want to look at and make sure it's the right plan for you.
Well, I can certainly see the attractiveness of having everything all in one place and having one card with one phone number I call when things go wrong or I have a question. So that would be Medicare Advantage or Part C, is rolling all of those things up into one place.
It can be the one for you. That one phone number is helpful. They, if you're a member on that plan, they can help you on claim questions or doctor questions, any kind of questions. That one spot could help answer it for you. And whether it's a narrow network or a broader network, hopefully you're getting the coverage you need.
That's excellent. As I approach retirement age, Medicare eligibility age, only a couple years away, my family members, I have a very large family, and they tend to call me with questions about their Medicare choices and how things go. Now, I'm not a licensed agent, so I will refer them on occasion. But one of the things that an agent told me that I thought was brilliant, and I want to repeat it every chance I get, is that when you're thinking about a new plan, I want you to think about the 3 Ps, right? The first P is always got to be provider. You want to make sure that the doctors that you use, the hospital that you use, the clinics that you use are included in the network of the plan you select. The last thing you want to do is get into a new year and find out your doctor doesn't take your insurance. That would be a terrible blow. And once you're retired, you don't want to go doctor shopping if you can help it. So the first P, make sure your provider is included in whatever plan you select. The second P is pharmacy. Most of us, by the time we're 65, are at least on 1 or 2 prescriptions. Some of us are on many more than that. And we want to make sure that the drugs we've been prescribed are covered in the plan that we select. And you can usually find out what the copays and coinsurance payments will be before you select the plan, so you'll know what your exposure is to cost. Very important. And then the third P, I call it perks. We were talking about it just a minute ago. Extra features that a plan might offer. Those are wonderful, but I might take a look at physician and pharmacy first before I go digging into the second part of the piece.
Yeah, and so you talked about prescription drugs. So understanding the copays. Now, if you're working with an agent, they may help you. There's some generic options. You can get lower cost. There is, a 90-day fill or mail order options. So there are options, those ongoing prescriptions that you need, they can help give you some guidance to hopefully you can lower those costs. And you can kind of get them to you, kind of set up, automatic, shipped to your house. Those are the kind of things that a licensed agent can help you kind of just make sure you're getting the most out of your plan. There's no cost and obligation to call this toll-free number to ask questions of a licensed agent. There's no pressure. You just need your questions answered, the timing, when you want to retire, what you want to opt into, what kind of plan's your best fit. That's the kind of agent you want to talk to. They want to make sure you get the best fit. And because if you don't get the best fit, you're going to be unhappy. Then you're going to be, looking again for another plan the next year. You want to get something that'll fit you year 1, year 2, year 3, a plan that will kind of, as your healthcare needs change, it will, it'll meet the challenge.
And that's an excellent point. Recently, I put a couple of my prescriptions on 90-day refills, and they come directly to my house. And I got to tell you, I'm sure that I'm way more compliant with my blood pressure medicine, for example, now that I know I don't have to go find it or find the doctor or make changes. A very big deal. You heard Tress mention agents. I want to give you this phone number, 1-800-568-1417. That can get you in touch with an agent who can answer your questions, licensed, certified agents that are very deep into the weeds on this stuff and really know all of the nuances. If you want to use the internet, bcbsla.com, plan.com, bcbslaplan.com/Medicare will also give you a window into getting access to an agent as we go forward. Now, it's sad that we have to talk about this, but I do want to bring up the fact that we have observed an increase in people's desire to scam, to separate our seniors from their money through the most insidious plans as we go forward. And I want to share with you the latest one so you can be on alert for this. There's a group out there who've gotten the phone numbers one digit off of our normal customer service phone number. And if you misdial and you reach these people, they will tell you, oh yes, we're Blue Cross and we're doing all these wonderful things. And if you'll give me a credit card number right now, I'll give you a $100 food card for $30 or something like that. I want to let you know up front, that's not us, all right? We're not going to ever force you to give a credit card number over the phone. We're never going to have that sense of urgency. You need to buy it now. If you get a suspicion like that, please don't give anybody your information over the phone. The best thing you can do, honestly, is to just hang up if you're not sure and call the number on the back of your card again. There are some situations where people at Blue Cross might be trying to reach you. Isn't that right?
Yeah. There may be times we will call you, but there wouldn't be a sense of urgency. It wouldn't be scary. We wouldn't be asking for credit cards. Maybe we're offering you a program. There's a certain chronic condition that you have, and there's a program for you to get involved in. So there could be an opportunity for you. But if you're uncertain and it sounds strange and unusual, then yeah, definitely hang up. Don't worry about being rude. You have the number on the back of your member ID. So you would get back in touch with our customer service, and then they could confirm, hey, yes, we were calling you. Let me route you back to that department. They wanted to talk to you more about this or that. So unfortunately, people committing frauds to seniors, it happens. It happens all the time. They're good at scaring you and good at making you kind of get flustered and make a decision that is not good. So if you ever feel like that, that's your signal. Hang up, disengage, stop this interaction immediately.
Another fraud that we had experience with just a few years ago involved some unscrupulous people switching the health plans of Blue Cross members to other plans without their permission. So these folks would go to the pharmacy and their Blue Cross card wouldn't work anymore. We were able to help those folks very quickly, retroactively pay bills for them. Don't hesitate to call if you have any suspicions at all about what's going on. Again, 1-800-568-1417. If you want to speak to an agent, if you have questions about any of the plans that you see, or you can do it online at bcbslaplan.com/Medicare. Either one is great. I think that's about it for us today. It's been a delight talking to you as always.
Right.
And Medicare, any last thoughts you would like to send out there during the wide open annual enrollment period?
There's a lot going on. There's a lot of information. Don't let anybody pressure you. Kind of get to someone who can help answer your questions, who has this methodical way of doctors and drugs and this understanding what your needs really are. And then you're going to feel comfortable with your plan choice. That's what we want. We want the right fit for you, the right plan for you, because we want you to stay healthy and well and leverage your plan, leverage your benefits. So I get it's overwhelming, but there are folks out there licensed and ready to answer all your questions.
And I can't say it any better than that. Thanks for being with us today. You're watching Medicare Made Easy, brought to you by Blue Cross and Blue Shield of Louisiana. I'm Mike Bertaut, healthcare economist with Blue Cross and Blue Shield, and we are very appreciative of your attention with us today. Thanks very much.